Well, hello and welcome to today's webinar, Prescription for Engaging Patients. I'm Carol Flagg of Answers Media Network. Thanks for joining us today. Patient experience impacts your health system, reimbursements, and patient outcomes. But the clinical setting is not all there is to a patient experience. Everything from the first time a patient researches a doctor or a health system to when and how that patient pays their bill is important. On this webinar, Regional Health System Calvert Health and Windstream Enterprises discuss and give real-life examples on what they're doing to increase patient satisfaction and patient engagement. Before I introduce our presenters, a few housekeeping issues. First, a copy of the recording of today's webinar will be sent to you within 24 hours of the event. Also, we will leave time for Q&A. Please use the question toolbox found on the right side of the webinar dashboard to ask your question. And now on to our presenters. Phil Campbell is a Navy veteran with a storied career as a ship driver and intelligence officer. He's a graduate of the U.S. Naval Academy and earned his MBA from the Thunderbird School of Global Management. He began his career in health IT 2 years ago as a CEO for Calvert Health. Calvert Health is a not-for-profit regional health system located in Calvert County, Maryland. It is one of only 6 independent hospitals remaining in the state, servicing a population of over 90,000. Kristen McInerney is an RN with over 25 years of clinical and analytics experience. Before joining Windstream Enterprise, she worked for Teradata and was also involved in deploying the DoD's EHR worldwide. She is also a Navy veteran and a graduate of both Georgetown University and Old Dominion University. Windstream Enterprise collaborates with businesses across the U.S. to drive digital transformation by delivering solutions that solve today's most complex networking and communication challenges. The Fortune 500 company is an industry leader in providing network services with 150 offices in 48 states. The company currently has over 2,500 healthcare organizations as customers. On the agenda today, Phil and Kristen will discuss the challenges and opportunities around engaging patients, offer up some solution highlights, look at lessons learned and future plans, and talk specifics on how healthcare organizations can improve the patient experience. We will close out the webinar with 15 minutes or so of Q&A. And now I'll turn the presentation over to Phil and Kristen, and I'll see you back on the Q&A.
Thank you so much. So Phil Campbell, CIO at Calvert Health Medical Center. We're a small community hospital and certainly facing some significant challenges as one of the 6 remaining independent hospitals in the state of Maryland. Rural healthcare provider located on a peninsula, so all of our fiber runs up and down the peninsula next to the one major highway that runs the entire length of the county, which means I'm essentially one backhoe away from losing my connectivity at any one time. So it was pretty critical that whatever solution we come up with address that issue. Making sure that we had redundancy between circuits as best as we possibly could. I also found that while we were going through our project, we realized we need additional bandwidth, and so the solution needed to accommodate for that. Our needs really weren't being met. Our capital infrastructure, the telephone system, was due for replacement in the next couple of years, essentially a forced replacement because it was no longer going to be supported, and that was a pretty big bill that we were facing, a bill that I wasn't prepared to pay. Our infrastructure was sort of the same infrastructure that I had as a young boy growing up in Louisiana. A lot of copper, a lot of punch block, and not a lot of advanced capability associated with the system that we had. And then finally, in our system, because we were all analog and connected to an analog system with copper lines coming out of the building, we really didn't have any data about telephone usage. I would get a phone bill, I kid you not, the phone bill is about 3 inches tall, and inside of that phone bill, somebody could have been running a private business and I would have never known, because there's no way I could have gone through all of that And that was just one of the phone bills. We actually received total in a month about 40 some odd phone bills for all of our different various phone services for both the hospital and employee physician group. So it was quite a mess to get your hands around what are we spending money on and why are we spending it. Then the final piece that we faced was our lack of resources. I really didn't have the financial resources to support to make that capital infrastructure buy, and a lot of the pieces were starting to break. It was really becoming a challenge to maintain. On top of that, the talent pool that I have here at Calvert, a little challenging. So if you take a thumbtack and put it in the map where Calvert is, and then take a piece of string equivalent to 30 miles, you wind up with a lot of water in there, but you'll also wind up with about 4 or 5 major hospitals and a lot of federal institutions. So I'm competing against much larger organizations with much deeper HR budgets for the same talent. And so that was a real challenge as well. A lot of the talent we had managing our phone system was homegrown, and they knew what they knew and nothing more. There was really no possibility to grow a sort of a professional phone technician support service in-house. And then putting all of that together, I really needed something that just get me, I say jokingly, get me out of the phone business. I don't want to deal with this anymore. I need somebody who knows what they're doing it, and so that I can focus on providing excellent patient care as a CIO at the hospital. Next slide. So the system that we brought in through UCAS provided us a number of opportunities to really advance more than just the telephone system. The telephones really became a catalyst for a lot of other possibilities within the hospital. So, for instance, in that first one, optimizing workflows, we had wireless companion phones, and our nurse call system had the ability to tie into them. But because we had an analog system, we had a limited trunk into those digital companion phones. So we weren't able to tie the call system to our companion phones so that the alarm would ring to the specific nurse assigned to the care team, as opposed to just ringing back to the desk and then the unit secretary finding the appropriate nurse to answer that alarm. So by implementing this system and going all digital, we were able to get our companion phones, we're working on that right now, get our companion phones tied into the nurse call system so that whenever an alarm goes off with a patient, the specific nurse assigned to that patient can go take care of it. And then there's obviously failover in the system, but all that's on the nurse call side. That's also allowed us to then move on to employing other technologies that we're deploying right now. So real-time location system that we have to integrate with the specific, with the nurse call system and the phone system, so that the real-time location system can say, well, wait a minute, the nurse that's assigned to that patient is in another patient room to which they are also assigned. So maybe instead of sending the alert to the nurse who's clearly occupied, I'll send the alert back to the unit secretary so the unit secretary can nominate another nurse to answer that alarm. So again, this move for us going digital really opened up the aperture for us to create a lot of other integration that just simply wasn't possible while we were still analog and we still had limited digital capacity. There are other opportunities that we're still kind of looking at for modernization. Some we're taking advantage of right now. As part of the process, it really highlighted, hey, wait a minute, your operator software that they're using, it's just not what they need to be using, and certainly won't work with this new digital system. You can stay on it, but you're not going to reap the sort of ROI that you expect out of this system. So we're upgrading the operator software. The Wi-Fi phones that we had several different models, some of which were newer and some of which were older. And of course, being a hospital, you try to minimize that capital spend. But those old phones just weren't going to work with this new system, and so we had to replace all those phones, which actually turns out to be a really positive thing, because now I've got one standard phone set across the organization, one standard battery charger, the whole thing. It also opens up opportunities for us to then migrate to perhaps smart devices and other types of patient care tools that really advance patient care in the hospital. Improving the patient experience, clearly, the better that the staff and clinicians can communicate, the better the patient experience is going to be. You don't have, whenever a nurse is walking around and experiencing drop calls, or can't get a phone call out, or can't get a phone call in, or they're having to run between rooms to clear alarms, that nurse is getting sort of more and more harried and agitated, and so their demeanor, their attitude will naturally suffer, because they're human just like the rest of us, although sometimes I think they're a little superhuman. Anyway, it really impacts them, and so by delivering a better infrastructure for the workforce, we inherently deliver a better patient experience, and that's a really good thing. And that kind of ties into that second one of improving the care team experience. So we're able to use this new system because it's all digital. We can route phone calls dynamically. We can use that to be a little more flexible in the way we assign our care teams and use our care teams. And frankly, our nursing staff is only just beginning to explore the possibilities based on what they could do with this system. Using smartphones to deliver text messages and video and audio to other care team members, that sort of thing. There's an enormous number of possibilities there that we haven't even really solidified yet, but they're sort of just these tantalizing opportunities to really advance patient care here at our small hospital. The built-in redundancy and failover, huge one for us. So I was paying for two internet connections from two different providers, as you do, but whenever one would fail, it's supposed to fail over to the other. Well, the failover didn't always work. That was one problem. But even if failover works, I'm still paying for two lines, and one of them sitting there not doing anything all the time until something breaks. So that was a real sort of a wasted opportunity, I guess, in terms of being able to deliver additional bandwidth and redundancy. So now we have SD-WAN. So if the system goes down on the primary, it'll automatically shift to the secondary. But really more importantly is whenever we're not down and then we have communication, we're able to communicate down both paths simultaneously. And that is really awesome for us, because it allows us to add bandwidth without adding any cost. It's all the same amount of money we were spending before. Also, because of the way the Windstream worked really closely with us on exactly the geography of where the circuits physically lie in the ground, how they enter the hospital from the road, what direction they come from, and where they are on the side of the road. So it's a 4-lane divided highway divided by a median, and the fiber's on one side. I believe it's the southbound side. The fiber's on, and then the cable that's the failover is on the northbound side. And so now I still, because of geography, still a little prone to it. But now that backhoe's got to be a lot bigger and has got to dig a lot bigger ditch before it affects me. So that's a big win for us. Connected locations. We have several, as everyone does, I think. We have several off-site locations, and we had the amount of silliness associated with those locations was just staggering. We were buying internet service, at the sort of local provider business connection, and they're, the triple play package where, you're getting voice and all the other stuff, voice and internet and all that sort of thing in the location. But what it was resulting in was just this enormous spend that didn't make any sense, and a lot of disconnected systems. And then on the disaster preparedness side, again, because of that that ability in SD-WAN to move back and forth, we've got a much better resilience in terms of being able to get out and not drop our connectivity while we try to do a failover or switch over, that sort of thing. And there's a lot of other opportunities for us to leverage the system as a digital system within the hospital that we can shift to a lot of different alternate configurations. One of the ones that we have is there's a primary data center that handles our voice in Andover, Massachusetts. There's a secondary data center that handles for failover, but if that secondary and the primary are both down, it will fail over to copper for local phone calls. So even if I lose the internet and I lose network connectivity, I fail over to be able to make local phone calls with copper lines, which is a really important piece for us. Next slide. So we talked a little bit about this on the previous slide with the different services or the different pieces that we got. So the solution provided us essentially all the connectivity we had before for the same amount of money, which I know sounds crazy but from an operational cash flow expense standpoint, year over year, my operational expenses actually decreased about $10,000 a year from where they had been before. So it was a wash from a budget perspective, which is always a win with the CFO, and gave us an opportunity to really wrap our hands around what all we had in terms of the circuits that we were providing outside of the organization and within the organization, and the different pieces that we had. We engaged our local vendor partner in conjunction with Windstream, so it was really sort of a three-member team effort. Our local partner called Plan B Technologies, I rely on them for quite a lot, and they stepped in and worked side by side with Windstream to make sure that we could address that talent and resource shortage that I talked about earlier with my workforce. They were able to fill that gap and bridge between the Windstream folks who are, obviously very smart, know the communication technology, but Plan B knows our local network. And so that was a really, really big piece of making this a win for us. And then on the network side, we talked about SD-WAN, the Ethernet and broadband pieces. Huge win for us. We actually increased our bandwidth, again, at no additional cost, a small savings year over year. And all that's before you get to the capital spend, which was eliminated. The vendor consolidation was a pretty big piece of it too. We had phone companies. I was getting phone bills from everybody and their brother. So this allowed us to get down to one single vendor so that, I had one point of contact. And what's really nice about the point of contact is I have one. I don't call and say, hey, I got an issue with our service. Oh, well, let me refer you to this other person. Or, hey, I got an issue with billing. No, let me refer you to the other person. No, I call my one single point of contact, and they take care of it for me. Now, they bring in the other members of the team as appropriate, but I don't have to go navigate another company's organizational chart. We did a lot in terms of collaboration to bring all the pieces together to make them work. We talked a little bit about that, and so this was a really good solution for the hospital. Next slide. Lessons learned. Wow. Do your homework. The network infrastructure that we had, one of the things that came out of our implementation for this was that we found that there were pieces of our system that just weren't ready for the upgrade. Now, actually Windstream did the work to tell us that on a lot of it. Our network infrastructure, we had Plan B in there, but we needed to make sure that we had all of our backbone straightened out. I mean, there's not much point in making sure or bringing in a digital solution on the front end if you don't have the back end to support it. And so we had to do a lot of homework. We still got caught on a few small issues, but we're working through those. And so that was a pretty big piece of making sure that we were successful in our transition, that we didn't fail from right out of the gate. That second piece, the device integration applications, that one was really critical. Again, sort of going back to that do your homework piece, look for all those opportunities, identify them early, because it's easier and best to do it as you do the implementation rather than waiting until the end of the implementation and going, oh yeah, we could have done that, because then there's a lot of rework and that sort of thing. So it was really important to give that some thought in advance, and so we did as much of that as we could, but again, we still sort of found things out along the way. That third one there on the left, verifying what phone numbers and data certs are active, that one was probably the most challenging part of the entire project. And that was a reflection of, I don't know how many years of phone lines associated with this health system that had been piecemealed together. We go out and acquire a practice, but no one ever closes the loop on getting their phone system transitioned, or they decide it's too hard, so we're just going to leave them on a separate phone system. Practice managers deciding, oh, I need another line, and just calling the provider and getting another line as opposed to going through the information services department. And so we had a lot of, this is where shadow IT, I mean, it was pretty, so much shadow was pretty dark. So we had to do a lot of work there, and they won't, the providers won't move numbers around unless you can produce the bill that has the number on it, and it was a real challenge there. So that, we knew that was a challenge. We invested 6 months in getting that right, and we still had some issues at the end. So if you don't know what lines you have, boy, you need to start that homework now. It's a really critical piece to making sure that you get it done right. And never underestimate the capacity of your legacy provider to cause problems with you in that process. I was staggered. Let's just say that my CEO was on the phone with the CEO of our current legacy provider at one point because of some challenges that we had. The bugs piece, so we sort of found out kind of at the sort of worst possible moment that our network infrastructure, the code that we had installed on our switches actually had known bugs associated with voice over IP, but none of us had thought to look at that and say, wait a minute, what version of code are we on our switches? Let's make sure we get our switches updated to code that doesn't have those bugs. And so that was sort of everybody got caught out with that one because we just hadn't thought about it in advance, and so that really affected call quality. We're going through the switch upgrade process right now to make sure that network infrastructure is appropriately passing the data with appropriate QoS settings. Again, that work with your current provider, who owns the circuits? The primary number for this hospital with our legacy provider was registered to an individual doctor, probably the doctor who got the phone line whenever the hospital first got phones. So whenever we went to port that number, our legacy provider essentially said, wait a minute, that line doesn't belong to you, we're not going to port it. But then they turned it off. So that was, and hence the phone call between the two CEOs. But that was a real challenge because we had no insight into what their records indicated, and they didn't tell us what their records indicated until after the fact. And so that was a big lesson learned for us. Apparently, this is a fairly common scenario for a lot of hospitals. This one was probably a little more than any others. But one of the side benefits that comes out of doing that, though, and this goes back to that self-funded roadmap for modernization, is we found through that verification process that we had a number of lines that we were paying for that there was no phone connected to them and probably had not been in years. A number of phones that rang out to nothing. Fax lines that, we're paying for these very expensive fax lines, they rang out to nothing. Well, when you go through and you verify your lines and your circuits and you start canceling all those lines, boy, the numbers really add up pretty quickly. And then finally, that balancing the time and effort. So, it's one of those challenges where you say, okay, we need to do all our homework, and we need to make this as good as we can possibly make it. Well, then you reach a point where, okay, how long are we going to take? How much money are we going to spend in the planning phase trying to make this go flawlessly, as opposed to where are we willing to take a little bit of risk by doing what we can, and then dealing with problems as they arise. And so that was a really tough balancing act, and that's really where the executive comes in to say, yep, this is good enough. Let's go forward, because you're never going to get to perfect. But that one was a real challenge to get right. And then there's also you get into the expectations of other executives where they say, hey, you have these problems. Maybe if you've done your homework more. Hold on, how much were you prepared to pay for that homework? So that's a conversation to have at your executive team meetings to discuss that balance. Next. All right, so now we're on to the great part. So how, here are all the sort of huge benefits over what I've already talked about. So I told you it was budget neutral on a year-over-year basis. We had essentially a 20% savings by cutting out all these phone lines and data circuits that we didn't need. So we saved a good bit of money, and all that brought it down into a cost neutral standing. We eliminated our capital expenditures and depreciation, and that resulted in a 10% reduction in total cost of ownership for the system. So I don't have to go and update that hardware in the basement of the hospital anymore, because it's being leased through the system, and that's huge for us, because that's a pretty significant capital investment. And again, it's a forced investment. There's no choice once you reach a certain point with your solution provider. I told you we boosted our bandwidth at no additional cost, because now I'm active-active, I'm not active-passive, and that's fantastic, because I'm pushing things into the cloud, and I'm doing as much as I can to modernize our data center here. The complexity, one of the things I've been doing since the day I got here is driving out complexity, because I'm not that smart a guy, and so let's make it simpler so I can understand it. We had 4 different phone systems in the hospital operated by 3 different providers. Now we've consolidated. We got 1 phone system. We're using 1 provider. That makes it so much easier. Whenever there's an issue, you know exactly who to call, because you don't have to figure it out. You don't have to worry about processing all those invoices. I mean, my workload's I can't wait. We're still closing out all the terminations, but here in a month or two, I'm going to be signing 1 invoice a month for phones. That's a huge win for me, and I know my executive admin will be a much happier person for that. And then, I said I was getting out of the phone business. You're never out of any of these businesses, but I'm out of the business of managing hardware. If a phone breaks, I call Windstream and it gets replaced. If something down in the basement in the data center associated with the UCaaS solution breaks, I call Windstream and it gets fixed. I don't have to go find the money. I don't have to go find contingency funds. I don't have to budget for all that sort of thing. It's just covered. It's just in there, and so I don't have to worry about that. I also don't have to worry about patching and operating systems and Spectre and all the other stuff that's out there. That's Windstream takes care of all that, and so that's a great solution, great answer for us, a big win. Especially considering the resource and talent shortage that I face here at Calvert Health. So that's a big piece for us as well. Pretty sure that concludes my portion.
Bill, thank you so much. I really appreciate it, especially when you said nurses were superhuman. That made me feel good. But thank you, thank you for your service. Thanks for any other veterans on the phone today for your service as well. I'm going to quickly touch on some customer service experiences within the healthcare setting. You know, this is truly how your patients see you as a healthcare provider. Every time they interact with you and how they feel about the services that they receive, this is what, you know, after several providers, you know, have talked to this particular source, and they brought up, you know, all these statistics. And you know as well as I do, if you're on the phone, you don't want to be on the phone for long. It's nice to know what number and queue you are, but in reality, you want not to have to tell this 3 different people the same information that you already punched in. So make it simple. Really know your customer, that when you're calling in, they should already know you. You've already given them the information. You want to treat them well. Treat them like you would treat your own family. And just understand that, you know, anytime that touch point happens, this is a relationship that's being built, and it's ever evolving. Next slide. Thanks, Molly. So, you know, providing this, you know, this seamless and focused experience is really the goal. It doesn't really matter. It's regardless of how your patients choose to communicate with you. You know, in different segments of our populations, you know, communicate differently. But, you know, number one, quick response via email or text or phone. Someone who understands, like I said, you know, who you are and what you need, and you don't need to wait a long time. And this is true whether you're a patient, whether you're a customer of a hotel, of an airline, it doesn't matter. Customer experience, you know, if you have a great customer experience, you're more likely to book that flight with that particular airline, or come back to that hospital, when in many cases the hospitals are competing for the same patients. Your customer experience is truly the underpinning of you know, how you're going to get those folks back in the door. It's also true for your personnel from a provider standpoint, whether it's a nurse or a physician or a medical assistant. If you want to recruit and retain those people, you have to treat them well. Next slide, please. So here are these technologies that are truly needed for a fantastic patient experience. You know, all those patient touch points that I said before, they require a fast, reliable, and a secure foundation. So whether it's the application that you're trying to connect to as a provider or as a potential patient in a waiting room, you have to have these technologies that are truly the underpinning of patient engagement as a service. I think we go to Carol now for our Q&A, which I hope everyone is very excited about, because I certainly am. So Carol.
Thank you so much. So we'll move over to the Q&A. Great presentation, and we've got some questions already ready to roll out here. For those of you in attendance, you can use the question box found on the dashboard to pose a question to Phil and to Kristen. So first question, what additional clinical workflow improvements that were not possible before do you see as a result of modernizing your infrastructure? I think that's a question for Phil.
Well, we spoke to a couple of those in the presentation. You know, the really exciting piece for me is, you know, right now we still have companion phones that are, you know, they have some functionality, but they're not, you know, sort of a touchscreen form factor that everyone's used to, that, you know, you see everyone using all the time. And so what I'm really excited about is the opportunity to move to smartphones, where now we can transfer the lines. You know, the users log into their phone line on the phone, and then they can log out whenever they leave, and the next user can log in. So it's pretty cool. The communications can follow the user as opposed to following a device, which is fantastic. And then because we're on a smartphone, now I've got so much more opportunity. I can put, nursing education. I can use, point of care applications, potentially EHR, depending on the size of the device, and the EHR, form factor and all that sort of thing. But the enormous opportunities for improving the patient care experience just by moving to a digital workflow or digital communication system just enables all these other pieces to move. It reduces the number of devices in the nurse's hands. She's not carrying around a barcode scanner and a companion phone and this and that and the other. We can consolidate all those items down into one device. Potentially, they don't even have to haul that card around anymore. They could just use a small form factor mobile device, touch input, and then have just use a regular documentation station back for anything larger that they need to access. So there's a world of possibility associated with this from my perspective, and I'm really excited to see it move forward.
All right. What surprised you most during your transition? That's for Phil. What was the biggest surprise?
The biggest surprise was just how badly our legacy provider was managing our vendor records. Staggering is the word I think I use pretty often.
What hardware are you utilizing on the SD-WAN that allows you to homogenize your bandwidth? That's a very technical question.
Well, so if you saw on the introduction slide, I'm just a pretty face.
And the naval officer that you are.
Hey, Phil, I can help. That's the SD-WAN
awesome.
Hardware is VeloCloud is the vendor.
Okay. VeloCloud. All righty.
Thank you, Molly, for saving me.
What are you planning to use the contact center as a service solution for today, centralized scheduling, and what additional use cases do you see in the future?
Well, so our contact center does patient scheduling right now, as well as handling billing concerns and billing issues and that sort of thing. So that functionality for that group is subject to a lot of other business decisions, but one of the really cool things that this solution allows us to do is right now that patient contact center is in our leased space in a building off campus behind a gas station. And that's where they take the phone calls and deal with billing issues. Well, I got to pay to lease the space. I got to pay to heat, cool it, secure it, maintain it, all that sort of thing. Well, now with this digital solution, I just tell those people, hey, why don't you go home and work from home? So I'm able to really change the way that we're doing the business in a way that really isn't evident to the patient, but achieves a significant savings on our end. And not only because of the ability to move the lines and have it follow the user instead of the device, but I can also use the data that comes from the system to be able to make decisions about how well are each one of those folks performing. Now, we had tools for that before, but the integration into a digital system is just so much better, and so there's just really a lot of opportunity there.
Are there additional speaking of opportunities, are there additional opportunities to modernize that you haven't tackled yet, and what would be your next priority?
Well, certainly there are additional opportunities to modernize, and they're kind of everywhere. I mean, you can start with, hey, let's look at our network infrastructure now. I'm putting more on the switching environment, so I need to make sure that that's a little more robust. And so I'm actually taking a look right now at our back-end cabling, but that's really boring stuff. The exciting stuff on the front end for patient care is, again, those smartphone devices. I think there's just an opportunity to revolutionize the way we deliver care here at Calvert with those devices. I think the ability to integrate the phone system, because every one of those nurses, every one of those clinicians, not just the nurses, every clinician is carrying a communication device. Well, the more that I can route to that communication device, the better informed they can be without having to be physically tied to a specific location. And so there are opportunities to then leverage that to go outside of the hospital, so that I'm not just notifying the care team within the hospital of an issue. Now I can notify that patient's primary care doctor if they choose. I can notify that primary care doctor, their cardiologist, their gynecologist, whomever. So the specialty providers who may not be in the hospital at the time, I can notify them, and it's almost like a sort of a modern day throwback to the old days whenever your doctor came to see you in the hospital. That doesn't happen that much anymore. Well, this system could allow us to have the doctor see you virtually from outside the hospital and be aware of your care plan, and then make appropriate inputs as needed to make sure your care plan is good for you because they know you.
One of the attendees want to know, and apologies if you said this in the presentation, but could you give a general estimate, the cost savings aside, how much of a time saver this move has created?
Well, certainly, so from a personal standpoint, I'm really looking forward to the time savings in terms of budgeting, processing invoices, signing them, chasing down discrepancies, having to, explain to people, why we have a 3-inch phone bill, that sort of thing. From an organizational point of view, for my department, modernizing all of these systems means, honestly, I'm probably saving at least a quarter to a half of an FTE in phone issues alone.
Yeah, that's considerable, obviously. Are you concerned about your organization adopting these new tools available? Are you concerned about your organization adopting the new tools available to them for collaboration?
Well, yeah, certainly. I mean, that's part of, again, part of the promise of some of those devices we talked about is that ability to collaborate beyond, the 4 walls that surround the patient. And so the ability to share information much more rapidly and securely by making sure that data is getting to the users who need it.
Got it. All right. Kristen, Phil, any last thoughts before we wrap up this webinar?
No, just thanks to Phil Campbell for really painting an awesome picture of how Windstream helped Calvert. But really, from your perspective, Phil, you had a really tough job, and you've made it a little easier for yourself. But you're doing the right thing for your patients, and I applaud you for that.
Yeah, thank you. I have to say that Windstream has been a fantastic partner through all of this. Our legacy provider was a global provider, and I'll leave it at that, a very large corporation. Our invoices for them are less than budget dust. They're probably budget atoms, So they had zero interest in working with us and building a relationship, and so we're if you're just a single person with your own mobile phone and you're calling about an issue, they have people who are trained to deal with you. If you're a large global organization working with them, then they have people trained to deal with you. There's nobody in the middle, and so I really found that going to Windstream was really a huge positive step for us, because Windstream is still a very large company, but they've got that customer service piece much better dialed in. And so there's one person that I call for every issue that I have. And so the person that I call, my customer rep, texted me before this webinar, "Hey, Phil, thank you so much for doing the webinar today, and I hope you do a great job." I mean,
yeah.
My legacy provider, they wouldn't know my cell phone number to text me. It just a night and day between the service. So really, really happy that that we sort of found Windstream and that we were able to build a partnership.
That's great. Phil, Kristen, thank you so much. I want to remind our attendees that a copy of the recording and the slide deck will be sent out to you within the next 24 hours. We appreciate your time today. I want to thank everybody for joining.